Do you experience vision problems more often? You're sitting at your desk, everything seems normal, and suddenly, your vision gets blurry. You see spots, flashes, and your control over your eyes starts to fade. Imagine this seemingly small problem could be the start of something serious. Sounds scary, right? It should scare you. Vision problems are not just a harmless side effect of your everyday life. They are warning signs from your body, signals that you can't ignore, because the range goes from dry eyes to signs of a stroke. The question is, do you listen to your body? Do you take these signals seriously? In this video, I'm going to explain everything to you, what you need to know, what vision problems really are, and why they are not just a coincidence. The various causes that you need to know about, from everyday stress to serious diseases like glaucoma or even tumors. When you need to act immediately, it's about your health, your eyes, your life.
Welcome to Endovision with Dr. Berger, your leading channel for insightful perspectives in the world of endocrinology. Here, we highlight the central challenges of our time: diabetes mellitus, obesity, thyroid disorders, and the essential role of nutrition for a healthy life. Subscribe to Endovision if you are ready to take your health to the next level. Here begins the path to a healthier, self-determined life.
Vision problems. This word covers a lot more than you think. We're talking about blurred vision, double vision, flashes of light, dark spots, or in the worst case, a sudden loss of sight. It can creep up on you or hit you out of nowhere. The question is, do you know what these symptoms mean for your body? Are you ready to take responsibility? Vision problems are no small matter. The causes may seem harmless, but many are serious warning signs. Let's take a closer look at the most common and important triggers so you can see how crucial it is to act quickly. A strain and dry eyes. Your eyes work tirelessly, often beyond their limits. Staring at the monitor for hours on end without regular breaks leads to a reduced blinking rate. The result: the tear fluid evaporates faster, the eyes dry out, and vision becomes blurred. Dry air in the room, air conditioning or heating makes these issues worse. And along with blurred vision, your eyes often feel heavy, irritated, or even burning. Migraines, flickering. Have you ever experienced flashes of light, zigzag patterns, or tunnel vision before a migraine attack experienced? These vision problems are typical companions of what's called a migraine aura. Migraines cause circulation problems in certain areas of the brain that affect the visual center. The symptoms often occur before or during the migraine and usually last 10 to 30 minutes. Many ignore these warning signs, but they are a sign that your body is at its limit. Refractive errors, vision problems. Refractive errors are common and often underestimated. There are 3 different forms. Nearsightedness, objects in the distance appear blurry. The cause is either an eyeball that's too long or a lens with too strong a refractive power. Farsightedness, near vision, is blurry, which can be caused by an eyeball that's too short, or a lens with too weak a refractive power can cause light to focus behind the retina. Astigmatism, an irregular curvature of the cornea distorts the image, making objects look warped or blurry. Glasses, contact lenses, or laser treatments can correct these issues. If left untreated, they put extra strain on your eyes and can lead to headaches or fatigue. Cataract. Cataracts are one of the most common causes of vision problems in older age and often develop gradually. The eye lens gradually becomes cloudy, often due to aging processes, but also from UV radiation, smoking, or diabetes. Blurry vision, light sensitivity, color fading, and even double vision can occur. A surgery where the cloudy lens is replaced with an artificial lens is the only effective therapy and is associated with a very high success rate. Retinal diseases. The retina is a sensitive tissue that converts light into visual information, and the damage can be devastating. When the retina detaches from the eye wall, quick action is crucial. Symptoms include sudden flashes of light, shadows, or a curtain that narrows your field of vision. Especially as we age, the central retina can get damaged. This makes reading, driving, and recognizing faces difficult. Macular degeneration. High blood sugar damages the small vessels in the retina, which can lead to bleeding and a decline in vision. Diabetic retinopathy. Without treatment, blindness is a threat. Glaucoma, called green cataract. Glaucoma is a silent, sneaky thief of your vision. Increased intraocular pressure damages the optic nerve, often without direct symptoms. Visual field losses then begin at the edges, unnoticed, until central vision is affected. Without treatment, the damage is irreversible. Medications and surgeries can slow down the progression if diagnosed early. Stroke, sudden loss of sight, sudden vision disturbances that are accompanied by speech problems or numbness are a clear emergency. Blood disorders in the brain interrupt the signal transmission to the eyes, and there is a loss of the visual field in one or both eyes, often accompanied by dizziness or paralysis. Act immediately. Every minute counts. A prompt emergency call can prevent lasting damage. Medications, side effects on the eyes. Many medications have effects that you might not expect. Corticosteroids can increase intraocular pressure and raise the risk of glaucoma and cataracts. With antidepressants, dry eyes and blurred vision are common side effects. Chemotherapy drugs can sometimes damage the nerves. What leads to vision problems? Injuries. Act immediately. Physical damage to the eye requires quick intervention. Foreign bodies like splinters, glass, or sand can injure the cornea or deeper structures. Burns from alkalis, acids, or solvents can cause permanent damage. First aid. Rinse the eye immediately with water and seek a doctor right away. These are not just medical facts. These are your eyes, your health, your future. Ignoring is not an option. Now you know why vision problems should never be taken lightly. Warning signs, serious and alarming. Now listen to me. If you have these symptoms, you need to act. Not tomorrow, not someday, right now. A sudden loss of your vision, flashes of light, or shadows that suddenly appear in your field of vision. Pain in your eyes that you can't explain. These are not trivial matters. Your eyes are sending you an SOS. Will you respond to that? The right diagnosis is the key to saving your vision. But do you know how thorough and precise the examinations need to be to uncover the cause of your vision problems? Let's dive in, step by step, because there can be no compromises when it comes to your eyes. Anamnesis. Your story matters. Your doctor starts with questions, a lot of questions. Why? Because every little thing matters. When did the symptoms start? Did they appear suddenly or have they developed gradually? How do the symptoms manifest? Are there flashes of light, a veil, double vision, or even sudden vision loss? Are there accompanying symptoms? Headaches, dizziness, nausea, or numbness can provide crucial clues. Pre-existing conditions and medications, diabetes, high blood pressure, migraines, or certain medications can be risk factors. Clinical examination. Every structure matters. Your visual acuity is tested using special charts. Color vision and contrast sensitivity are also tested to identify specific problems. Using a special microscope, the cornea, lens, and anterior chamber of the eye are examined closely. Slit lamp examination. Even the smallest injuries or opacities do not go unnoticed. Fundus examination, fundoscopy. With dilated pupils, the doctor can assess the condition of your retina, optic nerve, and blood vessels. A crucial step in recognizing diseases like diabetic retinopathy or macular degeneration. The visual field measurement, perimetry, shows whether there are any gaps in your field of vision, often a sign of glaucoma, neurological issues, or pituitary tumors. Intraocular pressure measurement, a hidden danger. Intraocular pressure is a silent betrayer. Too much pressure can irreparably damage the optic nerve, often without you noticing. Whether through touch or air pulses, every fluctuation is analyzed in detail. Early detection is crucial here. Imaging techniques. A look into the invisible. When there's a suspicion of serious conditions, high-tech methods are used. With optical coherence tomography, or OCT, cross-sectional images of the retina are created that make even the tiniest damages visible. It's essential for macular degeneration or diabetic retinopathy. In cases of suspected tumors, strokes, or neurological causes, techniques like CT or MRI provide valuable insights. Detailed images of your brain and eye socket. In cases of injuries and damage to the skin, or with cloudy media like cataracts, ultrasound can provide insights into the deeper structures of the eye. Eye exams may not suffice. Blood offers clues. Sometimes, eye examinations aren't enough. Your blood provides additional clues. Inflammatory markers show whether inflammatory diseases like uveitis are present. Poor control of diabetes can cause vision problems. In cases of suspected tumors like pituitary adenomas, hormone levels provide valuable clues. Treatment tailored for your eyes. The diagnosis is made, and now the fight for your vision begins. There are no standard solutions here, but rather precise, individually tailored treatments. Medication therapy. Eye drops, whether for lowering intraocular pressure in glaucoma or for moisturizing dry eyes, work right where they're needed. Systemic medications, anti-inflammatory drugs, antibiotics, or anti-diabetics help combat systemic causes. Specific treatments, like anti-VEGF injections for macular degeneration or diabetic retinopathy, prevent the progression of damage. In cases of retinal detachment, the retina is reattached using laser, cryotherapy, or a vitrectomy. Time is crucial here. Every delay increases the risk of permanent vision loss. The cloudy lens is replaced with a clear artificial lens during cataract surgery, a routine procedure with great benefits. Procedures like trabeculectomy create new drainage pathways for the eye fluid and lower pressure in glaucoma over the long term. With laser treatment for diabetic retinopathy, bleeding is often lasered away. Glasses and contact lenses are the simplest solution for refractive errors. But even here, the adjustment has to be perfect. Laser treatments such as LASIK or PRK can also correct this. Corneal problems can be permanent. Diagnosis and treatment are complex yet vital, but essential. Every test, every examination, every measure counts. It's about more than just good vision. It's about your life, your freedom, your ability to perceive the world around you. Don't take any chances until it's too late. Vision problems aren't coincidence. They are your body calling for help. The question is, are you listening, or are you risking a moment of carelessness that could cost you your health? If you learned something today and enjoyed the video, give us a thumbs up and share this knowledge. There are people in your circle who need this information, maybe more than you think. Subscribe to our channel, turn on the bell, and give us a like. Help us reach people who need to protect themselves. Your eyes are irreplaceable. Safeguard. Act now.